Okay, I think it's on. I never quite know because it's always saying connecting for some reason. Um, we'll just give it a couple of minutes. Some people trail in, whoever has the time to join, and then paid subscribers will get this anyways. They'll be able to access this in the replay library if this isn't a good time to watch. But we'll just give some people some time to trail in. On a different note, I've been drinking. This is ridiculous, but I've been drinking like hot beverages. Like if you know me, you know I'm really into like dandelion root. Um, and so I've been drinking my like, dandelion root latte in these like crystal kind of cups, and it's just giving me life because they're so beautiful. And I don't know if you can see it. This one's like purple, and they're just so cute. So I'm obsessed. Okay, let's give it like maybe 2 more minutes and let people trail in, and then I've only done like 2 lives before this, so still getting used to the community, but this should only be paid subscribers, so it should be more intimate. Let me just make sure that that's right. Okay, I think that's right. Okay, can someone just let me know if they can hear me? I don't know, the sound just did something funny. Okay, I think it's back on. Okay, well, let's just get started. So welcome everyone that's here, and to those of you who are going to catch this on the later side when it posts to the library. My name's Dr. Alysia. I'm the founder of a Black Women's Apothecary. If you're here, you probably already know that, but you probably haven't seen like my face or like done a live with me. So yeah, just welcome. I'm so excited to start doing these lives with you all. Um, and yeah, this one is really special because this is the start of my anniversary series, which, if you saw my emails, then you know that this is really going into the heart of like why I created this apothecary, why when I quit my job and even started this before my job, I just started seeing these like gaps in medicine and women's care, and specifically with Black and Brown women. And this apothecary was sort of like my home to come to learn about and discover and share the things that I was learning outside of Western medicine that were serving me, that were serving my patients, that were serving my communities. Um, and yeah, it just kind of grew into this platform that now has like 9,000 subscribers, which is insane. I never imagined that it would grow to that. Um, but now I'm dreaming even bigger. Like I want this to be a community for you all to come and to feel seen and to feel heard and to feel like you actually have a voice in the content I'm creating and the conversations we're having, and yeah, that you get to show up and really learn something that genuinely either inspires you, teaches you something you didn't know before, or like creates this kind of you know, energy in you to share and continue kind of educating others around you. So that's really what I want this space to be. Um, in my kind of dreams of it, I also just knew that like Black and Brown women just needed more spaces to connect and be together and heal together. And I wanted to be someone to create that for us. I could have used it. I could have used like, a grandmother or someone who had been through some of the things that I was going through and just like take my hand and be like, hey, it's going to be okay. This is what you need to know. And yeah, I really want this community to be that. So if at any point during my talk you have questions or, you want to talk about something completely different, like I'm absolutely open to that. I want this to be a community that connects and shares and feels really engaged. So yeah, just want to share that. Okay, so you know, the idea behind the anniversary series is to give you guys the foundational tools and steps behind how we heal ourselves, how women take control of their healing journeys, how they understand the missing links that the doctor's office isn't putting together, how they create a understanding of their body's signals that actually helps them like heal. Okay. And like this is different for every single person. So I want to share my own journey with it and how I actually came up with the system that I created around how we understand our body signals. And today we're just going to go really deep into kind of like my journey, the signals I was seeing. We'll get into my beliefs and what's missing in the doctor's office, and as well as just like why we deserve more and why Western medicine isn't giving that to us and why it's not structured around that, why it literally is impossible to receive what you need inside of the medical system. And just some tips on how to get back to yourself. I am going to go ahead and give you access to this PDF, which comes with this live today. So I'll just post it in the chat. Hopefully this works. Yep. And then you should be able to open that and keep that for later. Um, but that is essentially the framework that we're going to get into over these next couple of weeks. It's for you to see and to kind of understand the relationship between the different systems we're going to be talking about. And each week kind of builds on the week before it. So you'll watch today's live, you'll probably get some questions. Next week, we'll ideally answer some of those questions. And then the following week, we'll answer even more of those questions. And if you really want to go deep with me, then the following month, we're actually going to have on some guests who are going to talk about specific women's health problems. So fibroids and PCOS, just in case that's something that you're moving through. And that all of those conversations will essentially build on this foundation that is essentially the foundation that's missing in Western medicine. So we'll just get started. Um, so, okay, so starting with this idea that your chronic illness, your presentation of some disease. Ooh, any talks on endometriosis? Yes, I am currently looking for a specialist in endometriosis, but if I can't get a specialist, then I will happily go deep into endometriosis with you. That is 100% something that I struggled with. It took me a while to understand it. But once you do, it really, really is such a an interesting uh it's interesting because it's not I don't like it to call it a disease because to be honest, endometriosis can be healed. But it has an interesting profile and yeah, thank you for asking that question. Um okay, let me not get sidetracked. But yes, I will definitely have a live on that for you. That would be great. Okay, so Yes, we're talking about the patterns that present before your illness came. So this took me a long time to figure out. I've had 3 very significant health, crises in my life where, everything stops. You feel like it's kind of the end of the world. You feel like you're alone. You feel like you have no clue where to go or who to turn to. Your questions aren't getting answered by your doctor. And as a doctor myself, moving through these 3 experiences, it was incredibly isolating because I'm sitting here and I'm like, okay, I'm in medical school. I've gone through medical school. I'm currently a doctor right now. I'm someone's PCP and I cannot figure out what's wrong with me. And so this was like the frustration that kind of led me to just go insanely deep on my illnesses. So, for those of you who don't know, I my major illnesses categories were ovarian cysts, which came when I was around like 23. I had autoimmune like hair loss, which is alopecia areata, which came when I was about 27, and then long COVID, which came when I was like 29. So, in between all of those, I've had other chronic things come and go, but those were really the major things that happened that made me look really close at my condition. And when you're just before you're about to experience a health crisis, there's a point in which you start to get some early signals. And I say that while also being fully aware that we live these lives where it's incredibly hard to slow down and it's incredibly hard to really know what's a signal and what's not. And so I kind of just want to like walk you through the 4 patterns that I came up with that are like, this is a signal that something might be going wrong and it's time to pay attention. And, you know, when I start getting into like the missing piece of the doctor's office, like really it's this piece, this spiritual aspect, this psycho-emotional spectrum that is influencing your current condition. And I'm not saying that like you're causing your problems. I'm not saying that my hair loss was because I like did something bad and like whatever. Like no, none of that. It's that the psychological state that we have influences how our body works. And usually there are signs that your psychological state is a little bit off, or your emotional state is a little bit off, or your body is starting to work a little out of whack. And I'm going to walk you through the signs that I saw for myself and that I see in a lot of women that I used to see in the clinic. So the first one, there are whispers, and these look like fatigue, irritability. Maybe you've got a little bit more hair shedding than you originally had in the past. For me, when my hair comes out, like I have curly hair, so I wash my hair every 2 days, and I kind of roll up the hair into a ball so I can throw it away so it doesn't clog the drain, which may be TMI. But for me, if that ball is like a little bit bigger, I'm like, like that's when my signs like a little bit go up. I'm like, okay, there's a little bit more loss here than I'm used to. What's out of whack? Okay, so that's an early signal. Beyond that, uh, something that I talk about, which I have a couple of articles on. I also have articles on endometriosis. I'm not so sure if you saw those, but I have an article on PMS, and PMS is a really interesting sign because really there are dynamics that should move and flow throughout your cycle, and there are certain predispositions that are very normal to feel within the week. Oh, good. Within the week before you start your period. When those signals start to be increased, heightened, like uncontrollable, you're starting to feel like you are just like completely out of sorts and like can't control yourself, like that type of vibe, that is a sign that something is out of whack. PMS, I feel like has definitely gotten uh its own, what's the word? Just kind of like understanding in our modern society. But like the reality of it is, like, that's a signal from your body that something is out of whack. And it's not just a signal from your hormones, because your hormones are just, if you just think about those as signals, like, it's a signal that like something deeper is going on. And sometimes that can be a life thing that's going on, and sometimes that can be an internal body thing that's going on. So throughout the weeks, I'll help you kind of tailor that. But just somewhere to start. So at the same time that these symptoms are happening, these like little things that if you blink, you'll miss, you'll start to sense, maybe intuitively, maybe just kind of at the baseline of everything, that something's a little off. Like maybe you're less happy in your job. Maybe you're less happy in your relationship. Maybe you're having trouble getting out of bed. Maybe you don't feel as motivated to move your body or eat healthy, or certain things like that. And those are like the most minute signals that, like, okay, it's time to pay attention. It's time for me to like listen to what is going on in my body, so that you can start to read your own individual patterns, okay? Um Secondly, when I was moving through my last two like health crises, this is just something that I noticed. Survival mode can become a personality. So I was in residency, I was working 14-hour shifts, I was working 6 days a week, essentially running on nothing. I was like emotionally depleted. I had absolutely no empathy for my partner, for myself, for the people around me. Like, you start to just get really empathy deprived. And you'll still sit there, and through all of this, through all of those feelings, all of those emotions, all of those um personality changes, because you know who you are, I feel like this is maybe a question that could go even deeper, but we all have a really good understanding of who we are and who we like to show up as. And the moment that that starts to shift, like the moment that you start to see, hey, maybe I didn't respond to that the right way, or the way that not the right way, but the way that I maybe would have wanted to, or hey, like my personality, I used to have a lot of energy. I used to really want to hang out with my friends. And now I'm feeling like I just don't want to be bothered by anyone. I'm maybe numbing with Netflix or something else that is just really taking my attention off of whatever this larger issue is. We can start to just create a personality around that. We can just be like, no, this is who I am. I'm fine, which is what I did. I really started to create a personality around, I'm someone who's just tired. I'm someone who's just like old for my age, or I used to say all kinds of things. I mean, I used to be like, yeah, I'm like a 60-year-old woman in the body of a 30-year-old, or something like that, which like it negates the genuine point behind the issue, right? Like, why am I 60 years old in a 30-year-old body? Like, what is actually the disconnect here that I'm feeling? Like, I am constantly sleeping, unable to go hang out, unable to like even just like have joy throughout the day. Like what's wrong, So instead of saying like I'm fine, it's just me being tired for like months, like ask yourself the deeper questions of what could possibly be going on that is causing my personality to change in this way. Okay? Okay. The third thing is, we all have a relationship with self abandonment, that when we start to think about like why more women of color deal with autoimmunity, why more Black women deal with fibroids or endometriosis, why more, you name it. Black women have like pregnancy complications and all of these things. We have to ask ourselves, like, what is the underlying cause? And so often we forget that, you know, there are moments throughout the day that are asking you to honor your feelings, honor your body, honor yourself. And so often women, specifically women of color, were trained to just push that aside, be resilient, be strong, be whatever the term is, insert here for like how society has communicated to us to act. And I'm telling you right now, and I'm giving you permission to not be that way. Do not be strong. Do not be resilient. Notice what is happening, what is going on. Notice what your body needs. Ignore at some points, yeah, other people around you, because to be honest, like some of us are just too in tune to other people around us. And that causes us to create these dynamics of self abandonment, which when you're kind of trucking down the chronic illness path, there's all of these little moments in which, maybe you could have said no, or like maybe you could have taken your power back in a certain situation, there's all of that there. And it's just really important to like pay attention to that when you're kind of moving down this path and you're starting to notice some patterns. Okay, so then finally, after all of this is happening, you've got like you're in survival mode, your personality changes, you're noticing these like little minute signs, you're self-abandoning yourself within your life and your environment. Your body will finally just say no. Like it'll just say, I'm fucking done. I'm not doing it anymore, And that's when you get presented with whatever the illness is, insert here, okay? You start having insanely painful periods. You start noticing that your cycle, you're bleeding a lot more, like you are uncontrollably bleeding, maybe bleeding for even 2 weeks. Your hair is now like actually actively falling out. They call this active hair loss, which like your hair is literally like in chunks coming out of your head. You are noticing some sharp like pelvic pains outside of your cycle. Like, so all this to say, there's a buildup and it's slow and it's steady. And there are these like really um, to be honest, silent signs. Like if you're not looking for signs of something being out of whack, you will not see them and they will just absolutely pass you by. And then your body will start screaming. And I wrote a piece last week. I'm not sure if the people who are here or watching got to look at that piece, but the moment your body starts to scream, that's usually when you start looking for uh, solutions. You start being like, okay, like, is this endometriosis? Like, do I have fibroids? Like, what's going on? And you start to kind of ask those questions, and then you go to the doctor. And, you know, the idea behind like this kind of setup is that there were a lot of things happening before this specific problem happened. Yet, the mindset that you'll have when you go to the doctor is, how do we fix this? What's the band-aid? What's the pill? What's the, quick thing that we can do to just like get my hair to stop falling out immediately, or get these pains to like go away, or to just completely stop this bleeding. And at that moment, like, just pause. Just like give yourself a pause, deep breath, regulate your nervous system, and just be like these are the moments that you can start to introduce some of the things that we'll talk about. So, the importance of introducing the things that we're going to talk about is this idea that there is something that is missing in the doctor's office. So when you go and you're like, my hair is falling out, I'm bleeding too much, really painful period, acne, the things. Um, you're going to go looking for this quick fix. And the reality of it is, you're going to be dismissed, you're going to be minimized, or you're going to be rushed. One of the three. And there are structures that exist that create this dynamic within the doctor's office. So it's not always the doctor's fault that this is happening. And I say this because I was one of those doctors for so long. Um, you're looking at a 15-minute appointment time. Your doctor's looking for specific patterns in a lab. Specifically, like primary care doctors, they're not trained to read between the lines. Like, they're absolutely trained to just like see the red flags. Is this patient dying? Is this patient not? That kind of thing. Does this patient need a drug or do they not? That kind of thing. So even though your intentions for going to the doctor's office are to get to the root cause, your doctor is not trained to look for the root cause. They're absolutely trained to be like, okay, this person's bleeding a lot. Are they dying? No. Let's move on. You're good. We'll give you, something to stop the bleeding, whether it's like birth control or something else, and we'll just band-aid that and then we'll move on. And, you know, the reality of it is a lot of us are going to be told that everything is normal, all your labs are normal. Um, you know, yeah. And we're going to be frustrated at the end of that interaction. And it is because there isn't a framework around underlying like causes within the healthcare system. And there isn't a room for it. There's nothing like psycholiteracy within Western medicine. Like, all of that stuff I learned on my own through like other resources, other research. There's no understanding of like stress physiology. Like, we don't get taught about that in medical school, even though stress is like what's causing all of our chronic illnesses. We are not in a doctor's room as a doctor being like, oh, stress is causing this for this person. What's stressing them out? We're not doing that. Um, and there's a missing dynamic around psycho-emotional health leading to health problems. So there's systemic things that are causing you to feel unheard, unseen, dismissed in the doctor's office. And it's not your fault. It's not the doctor's fault. It's just the way that the system is created. So, Western medicine treats symptoms. It does not treat systems. It does not look at the entirety of an individual, and it is not like this system's off, that system's off. What could possibly be linking the two? It's not doing that. It's like, okay, you're bleeding a lot, let's stop it. Or you're having period cramps, give you some pain medication. You know, all those things. So, because of this, there is even more of a need for women to know body literacy, to know how to understand and to read your own body's signals and to be able to understand the context of those signals. So, no one really sits down and explains to you why or how stress, emotions, and lifestyle are causing what your current condition is. Like, no one is going to sit down and explain that to you, unfortunately, um, within a doctor's office. They're just not going to, because that takes significantly longer than 15 minutes. And most doctors just don't have that, which means that it's up to us to understand ourselves enough to be able to read our body ourselves. And within that context, then we can go to the doctor. And so that's essentially what I want to bring you throughout this journey is, you know, what are the signs, things that we need outside of the doctor's office to be able to understand and read our bodies better? This is something that I had to learn. I feel like I really didn't learn it until the last health crisis I had, where it was like, oh fuck, like I really need to learn this now. But it's been it's been trial and error for like many years of me just, oh, like, does this affect it? Does that, like it's this kind of touch and go game. But what I really found that we all needed was space, education, an ability to recognize our own patterns, a language for what our bodies are telling us, and then a way back to ourselves. And call it what you will, like every other form of medicine has this, which is the most insane thing. Like Western medicine is the only medicine framework that doesn't account for psycho emotional health. And the reality of it is we actually have the research and the resources to do that now. So it really doesn't make sense why it doesn't, but you're going to be the one to have the tools and the understanding of it so that the next time anything happens or the next time you're moving through a specific health concern, like you can work through it in this dynamic that actually takes all of those things into account. Okay, so um yeah. So so just to kind of go through like my own journey as like an example, we'll use like my hair loss experience for an example. So in the months leading up to my final like hair loss, there will be a essay or article on this later on in the week where I talk about actually how to completely heal autoimmune hair loss holistically. This works for anyone who's having any types of hair loss. This is essentially like the root of hair loss in this like really contextualized kind of protocol. So that's I think releasing at the end of this month. But it's essentially like how I healed all of my shit. And the context around like my hair loss was I had just gotten into a long-term relationship. I was probably about a year into that relationship. I was in my 7th month of residency, first year of residency. I was absolutely sleep deprived because my partner at the time like was a snorer. And you know what I talked about before are that there are these little things, these little ways that you self-abandon yourself. And it is important to recognize that those are going to lead to some sort of dysregulation, okay? And so for me, my little moments of self-abandonment were going into the relationship. I knew that I was someone who needed to sleep in a separate bedroom at least a couple days a week. And I'm a very light sleeper, so I knew that I shouldn't be sleeping with a snorer. Like I just knew that, right? Like before we even started dating, these are the knowings I had about myself. Beyond that, I know that I'm someone who is very influenced by the sun and the moon. And I rise with the sun essentially, and I sleep with the moon, and that is it. And there is no ifs, ands, or buts about it. I'm not someone who can really like even like stay up late or like it's just the things you know about yourself essentially. And during this time, I was working nights, like not something I should be doing. I was working like 14 hours through night time. I was delivering babies sometimes at like 3, 4 in the morning. My cortisol levels were peaked at like this 3 o'clock time in the night. And I started noticing that every single time I worked a night shift, I got sick. Okay. And thought nothing of it, was just like, okay, like it's nights. Like, of course I'm going to get sick. Of course this is going to happen. And would go back home, would proceed to kind of sleep in the same bed with my partner and wake up in the middle of the night really upset because he was waking me up with his snoring and uh, just yeah, just knowing deeply in my heart that like something was off, you know? Beyond that, of course, I'm absolutely fatigued, unable to do anything over the weekends. I'm literally needing to like sleep in sometimes for like 14 plus hours just to like restore any form of energy that I have because I'm just absolutely so fatigued. Um and so that was like 7 months. I was literally in this experience for 7 months before it kind of hit its peak when um we decided to have someone visit us while I was working nights. And, you know, I don't know if any of you out there are recovering people pleasers, but it was really hard for me to just be like, no, you know, like absolutely not. This is not something that I can handle right now, or this is not something I even want to engage with. And, you know, I grew up in a family dynamic where my like complacency and my ability to serve, be of service, or essentially just be like of silence, like was valued. That was valued. Like me just being able to like go with the flow and kind of fill in where I was needed was essentially like one of the reasons that I received love as a child. So being in a pattern and a partnership where, you know, this is what I'm bringing into the table and this is what's resulting in this kind of people pleasing dynamic for me where I'm not pushing back. I'm not, you know, saying actually what my needs are. And so yeah, all of that to say, like, these are all of the little tiny things that were building up until, you know, one day I'm on a night shift and I am like looking into my hair, which you'll see kind of a deeper dive into how this all transpired. But I started to see like a bigger part. And I was like, oh, that's weird. You know, as someone who's like really in tune with their body, you know, even throughout all of that, like was really in tune with my body. And I'm like, what is this? Like, why is my part like a little bit bigger, you know? And that's how it started. And then it just kind of trickled from there. I had by the end of it 3 bald spots the size of a quarter, maybe even bigger on my head. And I was sitting there just distraught, like at my lowest, just like what did I do to deserve this? You know, I'm someone who does believe in um you know, just like things not happening for no reason. I not that we cause things to happen to us by any means, but I like to treat life as like a lesson. And I was just kind of sitting there like, what the fuck is my lesson with this? Like I can't see it, you know? But eventually it took me kind of like 2 months of trial and error and just, you know, what you'll learn about me is the moment that something happens to me, I get like super deep into like every single textbook, every single piece of research I could possibly find on the topic. And I just go into it like as deep as I can because I know that me going that deep into that topic will help the next person who asks me like what about this, you know? And so I do that for myself anytime I experience really anything. I don't know if you guys follow numerology, but I'm a 7 in numerology. So it's like, I really need to get to like the truth of everything, which is probably why I'm like someone who's not just science, but spirituality. Like there's something about that that rings truth to me. And in this experience, it was like, Oh, my hair is falling out because I don't have boundaries. Like that's essentially what I like intuitively figured out. And from like looking at the illness from that framework, I then could build this routine for myself, this protocol, this support system for myself that helped me to one, like stop losing my hair within 2 months, which is really honestly unheard of. Like I hadn't even had a dermatology appointment before my hair started already growing back. I grew back all of my hair fully. Not only that, the rest of my hair grew back, grew like very long. I just essentially like changed my entire life at that time. And I think something that will be a pattern that you'll see is that when you have some sort of health experience, it requires you to change your whole life. Like, and it's important that you do that because there's some message in there about how you may have been living before this experience that, you know, if you don't kind of follow it through to the end, you'll absolutely miss it. And today I look back on like that experience, which was one of the hardest experiences of my life. I've always been someone who like really valued, I guess, my hair, which it kind of took me a while to kind of move through the I guess the shadow around like uh what's the word? Like vanity, I guess. Like you kind of have to move through that when you have like multiple bod spots on your head essentially and you're being told that this might like continue and you might just lose all of your hair, right? Like it really caused me to shed that identity for myself, which today absolutely serves me. So yeah, I say all that to say that my body was speaking to me way before my hair started falling out. And had I been just kind of slowing down, paying attention to the cues, it likely wouldn't have gotten to this point. But I am also grateful that it did get to this point because now I know what the cues are for myself. Now I know, I've been able to implement the routines, the patterns, the things that I need to not have that happen again? So yeah, just really interesting. And then, yeah, I noticed similar things to what I talked about before. Like, I wanted someone to save me. I literally went to my doctor as a doctor myself and was like, fix this. Granted, I treat alopecia areata all the time. I know that there's no quick fix for it. I know, that most, like, usually it progresses and it takes a while for your hair to grow back and all of these things, right? Like, our logical mind knows these things, but we're in such an illogical state because we're in such a kind of frantic, stressed state that we just can't even really see the underlying things that are happening when we have health concerns. Um, yeah, and then essentially, like, what I took from that was just like every time I healed something like that. I healed essentially, I wasn't just like fixing a symptom, I was healing the root of whatever was going on. And that is a pattern that I've had for my whole life essentially is that like when I get sick, I'm not going to just like band-aid it. I'm going to look for the root. I'm going to look for the root of what is going on. And sometimes that isn't just your iron is low or your B12 is low. It's not always these like functional labs that I feel like are getting so big nowadays. Like, sure, do your functional labs, see that everything's okay or see that it's not okay. But like sometimes that's not always the deepest you can go. Like the deepest you can go is looking into your psycho-emotional experience and seeing how this health condition is mirroring that experience back to you because oftentimes that is what it's doing. Like you are having some sort of experience within your environment, within the people around you, within your job, within your home, whatever. And your body is starting to essentially mimic that experience. And that's how you get the systems, which I posted the systems guide a little bit back, for you to download and keep. Those are the systems that start to get out of whack. And, the moment that we can start to understand that this is just something that is going to happen no matter what, when our external circumstances are, uh, you know, moving around, maybe not in alignment, that the more we can kind of detach from this idea that a doctor or someone else is going to save us. Like, we have to save ourselves. We have to do the work ourselves. We have to heal ourselves essentially, because that system is not going to do it for us. Um okay. Does anyone have any questions on, I know that was a lot. um Okay. And then this last little bit I have is just, you know, why do women deserve more? Like, why do we deserve a system that's built for more? And oh, oh, okay. If you can't access it through the copy and paste, then I will just go ahead and like make a post for it, and it'll just be like a paid post, and you'll be able to just download it from there after the call, or after the live. Sorry about that. Still learning the live experience. So, okay, good to know. You can't download from the live, but I will post it later. Okay, and that goes for all the other lives as well. I'll post them after. Okay, so then this kind of just tees us up for the next 2 weeks and what we're going to talk about for the next 2 weeks. And that is going to be this framework around why women deserve more and what we deserve. Okay. And so next week, we're going to talk about like why your body responds the way it does, like what systems are at play when it's responding. We're going to get really deep into epigenetics and how that plays a role in like what you're presenting with. Like, there's a reason that I presented with an autoimmunity issue and someone else presents with, you know, PMS or fibroids, like there's a reason, and it's in like each of our epigenetics. And so we'll kind of get into that. And then we'll also talk about like the role that your psycho emotional state plays in influencing your nervous system and influencing your immune system through this concept called psychoneuroimmunology, which is essentially what this framework is based off of. It's what's missing in Western medicine. It's what women need in order to understand like why certain things present at different times. Um, and then yeah, that'll help us just explore like a deeper relationship behind stress, behind illness, and behind why women burn out faster than men. Um, And then also, the last week will essentially just be, how do we feel safe in our bodies again? How do we like use these frameworks to actually heal ourselves? And how do we create a relationship with our body and with our symptoms and with our conditions, to which we're not always seeking externally for some quick fix? Like, how do we create that dynamic with ourselves? Yeah. Let me just, sorry, just going through my notes, make sure I didn't miss anything. Um, yeah, I really want to build like a future where women don't have to wait until we get sick to understand what's going on with our bodies, and to understand that your body to like the utmost extent, that you don't actually really need someone else to come in and diagnose what's going on, that you can actually just be like, okay, I know what's going on, this is going on, and then you can open yourself up to the intuitive information to how to heal that thing. Because at the end of the day, like with every single thing I've had, no one told me how to heal. Like, yes, I read all of the books. Yes, I read, researched and talked to all the people, but at the end of the day, like, you know how to heal yourself best, but you have to create the room for that to come through. And that's where like science and, our intuitive understanding kind of meet. And so we'll kind of get into that in the last week. Okay, so I talked for a while. Thank you all for joining me. You can post any questions that you have. I'll give you like you can post any questions you have now. And if you don't have any questions now, you can post in the comments of the live once this gets posted, and I'll definitely answer and respond to any questions you have. Beyond that, thank you so much for being a part of the um, Apothecary Inner Circle. And I just want you to also know that, like, I'm accessible to you within that circle. So, like, any questions you have, like even outside of this anniversary series, you can always just like message me or like message the chat. I'm very responsive. So like I will respond. And yeah, if you have anything you want me to write about, anything you want to see within the community, you're welcome. Thank you for coming. Anything you want to see within the community, then definitely post that. Beyond that, I'm looking to kind of create more opportunities for interaction. So yeah, I kind of want to like, so I do like a full moon circle every month. But ideally just having people like talk about their experiences in that is something that I'm moving towards. So let me know if you're interested in doing that. And yeah, thank you so much for joining me. I'll see you next Monday for the continuation of the anniversary series. And if you think that this content or this video or anything that I post essentially will serve anyone else, please share it. Like, we need these resources. Especially to any like Black, BIPOC, brown women that like we just deserve this information. So that's really who I do this for, essentially. I love all women and I think this serves all women, but essentially I'm just trying to bring education back to us, to people like me. So thank you so much for being here. And I'll see you next week. Bye.